Yo, what's up, guys? Hey, man, welcome back to the page. Welcome back to the channel. It's your boy, man, the X-Ray Zone. And hey, man, again to my day ones, I really appreciate all of you guys. And listen, man, follow me here on Instagram, also TikTok. I'm trying to drop videos daily, and more than one. It's so hard though, man. When you're in my shoes, man. I know everybody has different times and different things to do, but when you get to not when you get to, but when you're in my shoes, man, I work a lot, I travel. So it's hard to drop videos when I want to. It's not as easy as, I'm gonna just pop up a phone and do, pictures or make a video. Sometimes it is that easy, but it all depends where you work. Some hospitals allow you to show their equipment and they allow you to make videos, and some hospitals don't allow you to do none of that stuff, man. So I had to kind of pick and choose and be smart about where I do my content at, because not all, hospitals and areas let you do it. But anyway, man, I want to this video, guys, is the satisfactory between being a nurse or being an X-ray tech. So you always hear this, in the public, in the medical field. Oh, it's funny because when you're in your area, right, in radiology, and you've been a tech for a long time, you talk, you're like, man, I should have went for nursing, or I should have went for PTA, or I should have just went something totally different out of the medical field. And then whenever you go to nursing and you're in the nursing area, like the ER or whatever, they put up with so much stuff too, and they're like, man, I wish I went for X-ray, or I would have went for PTA, or same thing, just not even in the medical field in general. But if you guys are thinking about getting in the medical field and you're thinking about choosing whether you want to do radiology, whether you want to do nursing, this is a breakdown of what's best for you and the job satisfactory rate, I guess you can say, right? So for nursing, you have to understand that when you become a nurse, you have to be, say for instance, if you become a ER nurse, when you're an ER nurse, you have like, I think the limit is, I think, 5 or 6 patients per at one time. So you had to deal with 5 or 6 patients at a time, make sure that they get the correct medication, make sure that when the bell rings that you're there at their beck and call, make sure that they're okay, they don't fall off their bed, especially their fall precaution, make sure they're not falling off their bed and all that stuff, make sure the bed alarm is on. Then at the same time, if you have 2 or 3 fall, patients, you got to make sure that all 2 or 3 of those people, the patient's bed, are alarms on, make sure that they have their call light with them, make sure that if they call, that you have to run and make sure that you're there. So from the ER standpoint, as you can see, nurses pull up with a lot, they do a lot. So it's highly stressful. It's a highly stressful position, highly stressful job, in the ER setting, right? So I was, Googling a little bit, like, hey man, what's the job set? Just got a my curiosity as well, like what's the job, satisfactory in nursing, So when I Googled it, I screenshot it and I came up with this. Yeah, man. So it's one of those jobs that are highly burnout, because again, man, how can you not be burnt out of doing 6 or 7 patients at a time, making sure that all the patients have the right medication, making sure that all the patients have, their proper, just everything that they need before you go and attend another patient, when you have 6 patients to do at a time. How hard is that, for you as one person? It's tough. It's not easy, so you have to be careful. You have to make sure that you're aware at all times, make sure that you are doing your rounds, because then patients can fall. You have no idea how many times us as X-ray techs have to go to the ERs, not because the patient came from the ambulance and came from here, or the patient fell while he was in bed. We get those calls all the time because of the fact that nurses have a lot on their mind, they have a lot on their plate. So things like this are bound to happen. So that's something that you have to understand as a nurse, if you get into that you have a lot to deal with when it comes to patient care, and doctors being, kind of like behind your back. Oh, you need to do this, you need to do that. And it's tough, man. At the end of the day, it's tough to be a nurse. Now, again, like me, I've been in, radiology for 13 years. I've seen a lot, I've done a lot. I got into CT, I've worked in urgent cares, I've worked in hospitals, I've worked in, imaging centers, outpatient centers. Like, I've worked everywhere, and we also, get burnt out, to a certain extent. Um, it's just like nurses though, we can also move around. So it's kind of like we can move around and do this and do that. But we also get a lot of patients at the same time. We get a lot of orders at once. So when we get the orders in, we're like, we have to make sure that we go to the right room. Sometimes registration messes up, so you got to make sure you check the wristband. You have to make sure that the patient, everything matches on the requisition sheet, which is the paper. Make sure that all that matches, so that when you go do the patient, you're not, x-raying the wrong patient. Imagine if you're doing a CT and you're injecting contrast on the wrong patient. They're like, their kidneys can't do it, and you put them in a kidney failure. It's very, very, it's dangerous. So you have to be really aware of what you're doing at all times. Even if it gets busy, you have to understand, you gotta calm down, slow down, one patient at a time. But I also wanted to know how dissatisfactory it was for, for radiology. I Googled it, like everybody Googles, and this is what I came up with. And there you go. It's a better satisfactory career because of the fact that we don't deal with the patients all the time. As far as like we deal with patients all the time. Let me rephrase that. We deal with patients all the time, but we don't sit there and we have to be long term with the patient. We go in there for like 5 minutes. Hey, my name is so and so, ma'am. I'm about to do this X-ray of your chest, or sir, can you lean forward and put this plate behind you? Adjust the tube. Hey, take a deep breath in, hold it, boom, and we're out. That's it. Simple. Yeah, we see probably more patients than the nurses do on a daily basis, but at the same time, we're not there with the patient, like attending to every call, attending and making sure we're doing rounds, making sure they don't fall, making sure they're not choking on their food, or whatever the case may be. We don't have that kind of responsibility. So in that responsibility, we are truly, not as stressed as nursing. So that's something to think about, guys, when you're out there trying to think about a career, trying to think of picking a proper career. And these are just this is just nursing and X-ray, kind of like in a nutshell. Nothing too deep into it, but this good does give you insight on what to expect when you decide to make the proper choice that's for you. In radiology, you have things that you can get into, which is CT, MRI, ultrasound, nuclear medicine, PACS administrator, CT lead, mammal technologist, radiation therapy. Then you can get into cath lab. Then there's just so much you can get into when you become a radiology tech. Same thing with nurses. When you become a nurse, you can work in everything. You can be an ER nurse, pediatric nurse, outpatient nurse, second floor nurse, oncology nurse, orthopedic nurse, ICU nurse, PCU nurse, recovery nurse. Like there's so many things you can do. So at the end of the day, they both have good leveling. Like you can level up to a certain extent. They're both really good careers. So this is just something to break it down, so you guys know, like, man, am I making the right decision? Am I not making the right decision? What's best for me? What's going to be best for my future? What's going to be best for my family? Because a lot of people go to school when they have kids. They have kids and they have a family to attend to. They have a husband. So you have to pick a good career that's going to be good for you. Like, you don't want to pick a career that's going to be highly stressful, and you're going to go home and take all that home. Like that's something that it's hard to not do. When you're stressed out all day with patients, other nurses, because other nurses get on other nurses' nerves, and things of that nature. So that's things that you got to think about, guys, before you picking a career. So yeah, man, I hope that this helped you guys out there. I hope that this helped you give a better, clear decision on what is less stressful, what's more stressful. And hopefully you make the best decision for you. As always, guys, I want to thank you guys for coming on here, watching